This is a course on emergency preparedness. So why are you addressing the topic of Memorandum of Understanding? And how is that relevant to emergency preparedness? Well, according to the Centers for Disease Control and Prevention, the CDC, Memoranda of Understanding can effectively assist state and local governments, the Aging Services Network, state and local public health, and emergency response officials in sharing information, data, supplies, resources, equipment, or even personnel for the purpose of protecting vulnerable older adults in emergencies. That's why. Prior to any emergencies happening in your community, it's a good idea to have community partners to rely on during and after the emergency. In order to formalize the various relationships with partners, it's a good idea to have in place mutual agreements as to what is expected of each partner before, during, and even after the occurrence. An agreed-upon written memorandum of understanding is an excellent idea so that all parties understand and agree to what they are to do in the event of a community emergency. Now, it's particularly important to the workings of a senior center. Using the template from the CDC as a guide, your center might want to consider initiating a Memorandum of Understanding, or MOU, with your community partners. So let's take a look at the CDC MOU template. Partners. Determine which entities are involved in addressing the needs of older adults in your community during an emergency. Invite the entities to create an MOU that addresses needs of vulnerable older adults. Determine which parties will be the signatories to the MOU. All parties to consider being at the table to develop an MOU, including the Area Agency on Aging, local and state public health departments, local and state mental health departments, local emergency managements, the State Unit on Aging, home health care providers, tribal entities, and other community-based organizations. Another thing to do is to consider inviting seniors who are a part of your center and invite their participation in the MOU planning. Now let's talk about definitions. Inform the partners of the types of physical, mental, and resource impairments that may make your participants vulnerable for the purposes of this MOU. Agree upon the types of emergencies or disasters covered under the MOU, or consider an all-hazards emergency approach. Next, determine the ways in which different hazards affect vulnerable older populations. You need to determine specific services that must be maintained in order to protect older adults. Agree upon the specific needs of older adults that must be addressed. And last, agree upon the roles of each of the partners. Next, we ought to talk about the communications and messaging of an MOU. The communication and messaging include developing strategies and messages for all of the participants. You need to determine who will develop communications and media messages tailored to older adults in the community. The MOU should establish agreements with community-based organizations and faith-based organizations to target older adults in the community with that messaging. The MOU should also collaborate to develop and provide radio and TV spots aimed at the older adult population in the community. The MOU should create agreements between the public health sector and your senior center to facilitate vaccination programs and other public health services for your participants. Now let's discuss the relationship between the parties. Define and agree upon specific parameters of the relationships between the parties to the MOU. Determine and agree upon information flow during pre-event and response. Create a plan of who contacts whom, who initiates the process, and focus this plan on specific positions as opposed to certain individual people. Next, agree upon what information will be shared and whether there are jurisdiction-specific restrictions. Discuss HIPAA compliance and state confidentiality laws. Determine applicability and set up procedures for sharing information in times of need. such as obtaining consent from individuals before an event occurs. You need to agree upon and create simple operating procedures, such as a one-page addendum. Include the who, the when, and the how, so that during response, this document can be easily accessed, understood, and implemented. Now, all parties to an MOU should agree to meet and review the MOU on a yearly basis, and to update information to all parties as needed throughout the year. If possible, you need to agree upon the specific request for assistance prior to an event, what you need, where you need it. You also need to agree upon response time for requests for assistance. In the MOU, you need to include a provision about testing the MOU as part of regular exercises. These are just some ideas for a Memorandum of Understanding. You don't have to include all of them, but you should, at the least, consider an MOU that works best for you in your community. Having partners before, during, and after emergencies will help enormously. The more helping hands during times of crisis, the better. An MOU just puts down in writing what each of those helping hands can do to minimize the effects of emergencies and disasters.